I was born 1965, so about 67. Back then, it wasn't really known. It was one doctor in the whole of the hospital that finally figured out what was wrong with me. Definitely, I realized as I was growing up that there was something different, and I was always here. And of course, the injections having to be prodded, because I used to have regular blood transfusions, and was pretty anemic growing up. So sometimes I have blood transfusion once, twice a year. So all those little things will make you know that there's something strange. But my parents never really talked much about it. Their one was that they just kept telling me, don't do this, don't do that, do this, do that, and all that stuff. Apart from the normal crisis, which everybody has, I had quite a number of things. I had one, a vascular necrosis of the bone. That was when I was about 12, 13. Mostly because I had an infection in the bone due to a wrong blood transfusion that was given to me. And then that had me using crutches, being bedridden for about 6 months. Then I had gallstones, so I had to have my gallbladder out. Then I also had osteomyelitis, leg ulcers. It lasted between 3 months to 3 years, refusing to heal. So I had about multiple wounds in my legs, tibia, and my hip, having to dress it on a regular basis every day, which was pretty frustrating and depressing. Crisis is common to most people with sickle cell because it comes as a result of the way our blood is. Our blood is not round. It's like a banana shape and it's hard. So it gets stuck in the blood vessels when it's moving up and down, and it's when it gets stuck and flow of oxygen is reduced and all that. That's when the pain crisis comes. Now the pain is not like, because people have a misconception that the pain is like headache. No, it's not. It's worse than that. It's worse than labor pain, because I know people who have sickle cell and have gone into labor pains and have said that the labor pain they had was nothing compared to the crisis pain they had. And I can say from my own example is that if you've had your car slammed on a car door and broken a bone, that's pain. Yes, you have a finger. If you've had it and you've broken a bone, you can know how excruciating that can be. But that pain is still minute to what you will experience with sickle cell. So the pain from sickle cell crisis is really, really bad. Yeah, well, for anybody with sickle cell, there's the challenges of adapting to societal things, especially with your regular admission. So you have to adapt to going to school, and sometimes because of you are sick, you miss classes. So trying to catch up can be frustrating. You're now worried about how do I get the notes, how do I follow up with all my exams and feel, to carry overs and all that stuff. It disrupted my education a lot, especially because of the 6 months I was bedridden and all that stuff. I stopped school. In fact, I think when I went back into university, all my friends had already even left university and were even doing their youth corps by then. So, but I insisted that I wanted to go back to school. It was a struggle, it wasn't easy, but I qualified and I finished with a BSc in economics. It was emotionally draining, but I was able to think positively and not let it stop me. So then when you go through that educational process to now get into work, trying to get people to even accept you, to employ you, can be really difficult. I decided I wasn't going to work for anybody. I started a cake business. I ran it for about 16 years, because I just felt I didn't want any person telling me, oh, you didn't come to work today, you didn't do this, you didn't do this. With my own self, I will be able to determine, okay, I work this load, I don't work this load. Major psychological aspects is fact of self-acceptance and acceptance from society. It breeds low self-esteem, especially when parents are not supportive. Thankfully, mine was. So mine was more of self-acceptance, trying to accept, okay, I have this disorder. I shouldn't let it rule me. I shouldn't let it stop me from achieving what I can do, and which is something I see young people living with sickle cell have a challenge, especially when they don't get support from their parents, because at that age they feel you should be on your own and all that. But the parents forget that, look, they not only have to battle with finding finances for their regular lives, they have to battle with their medical health, and it can be pretty challenging, especially when employment is an issue. So I always encourage them that parents that, look, yes, they are old enough, but still give them that support, because every step of the way they need the support that family gives. You cannot take that away. And one of the important things about life, which is a fundamental thing, is the attitude of giving back. When you give back, you won't forget your issues. And the mind is very powerful. When you dwell on your issues too much, or wallow on your issues, self-pity sets in, your body begins to resign the fact that, oh, this is the end of you. But I didn't stop that. I went into having a business. I went into the NGO, giving back. I went into even writing books and doing things that occupy me. Get yourself involved. Then number one for me is my faith. Because sometimes, as I always say, men can disappoint you, but God never does. If you have a problem, go back to God. And then surrounding myself with people who were encouraging me, not self-pity, because that doesn't help. I don't want those people who say, hey, yeah, sorry does not help. You need people, Toyin, you can do it. Toyin, go on. Toyin, do this. Toyin, do that. Toyin, you're down now. Don't worry, things will be better. You push on. And I've lived all those. It's all about our esteem. If you disbelieve that, oh, they say I will die, but you don't accept because somebody says, it's only God that can determine when somebody's going to die. Like I told somebody one day, if you believe you're going to die, you will die. I always tell people the only reason why people pass on with sickle cell is complications from sickle cell because of mismanagement on the part of the person, or on the part of the doctor, or on the part of the family, because there are sometimes families are so eager to find solutions to the child's problem, they don't wait. They don't study, they don't understand. So any doctor that says, oh, let me do this, they just accept, and they'll do it because they are desperate. With the boy we're dealing with now, we're even going to try and do some fundraising for him. He's really emaciated, 23-year-old boy. But they went in to go and do, they were sent to Ibobi to do operation, hip surgery. And they now said, oh, they couldn't do it in Ibobi. So the next they recommended to them private doctor. And the private doctor did a heart check job. And not only that, normally even if you do the surgery, you're supposed to wait like 3-6 months, rest in one place. The boy went back to school and was pushing on that knee till the hip, till that knee gave it, and then he started having infection on his knee as well. So he's really bedridden, and unfortunately the parents are now blaming the boy. Are you the only one with sickle cell? Get up and walk. You can't see this guy is like skin and bones. Where is he going to walk? So that's why I say parents have to have an attitude of, you brought this child into the world. You did this. You had made all this decision. You have to educate parents that, look, it's not everything you hear, everything you see, you must do. Always get feedback, second opinion, if possible, third opinion before you just enter anything. We started sickle cell advocacy about 2008 officially, although 2006 we were doing it behind the scenes and all that. First of all, I wrote a book called Still Standing, which was chronicled my experiences living with sickle cell. And the feedback I got, I realized there was a lot of issues about information about sickle cell, about supporting people with sickle cell. So that's what made me start it. Challenges I've faced. First thing is that not many people or organizations still have attitude towards supporting sickle cell. It's just now that it's coming up a bit, but most of the time you're hearing people, oh, we do HIV, we do tuberculosis, we do malaria and all those other major things. But they don't realize that there's an increase in sickle cell. and we need support, financial support, as well as manpower, which is really because of finances. When you don't have the finances to pay, you can't employ people who can work. And then also the challenges of getting your beneficiaries to understand that there are certain capabilities that you can do. People believe that NGOs are there to help them all the way, which is not true. You help them in a specific, because each NGO is focused in a particular area, as is to help you with your health issues. Our belief is that we need to teach you to fish. We can't be supporting you for the rest of your life, and not to be so dependent on people just giving arms, because that does not make the person a strong person. So it's been challenging, but I think we've progressed over the years. Being able to sustain a monthly clinic for the past 1 year has been a landmark in my own perspective, without any external funding, apart from those within our field, our members and all that stuff. So I think we've been able to do pretty well. We could do more. There's a lot more that we want to do. There's a lot more people we want to reach. There's no sickle cell health policy, for one, in the whole of Nigeria. So I feel there should be a proper health policy concerning sickle cell. There's a proper health policy generally, because our health situation in this country is... I said something, God help you if you are ignorant and sick. Then God double help you if you are ignorant, poor and sick, because in this country you will not survive, and that is the challenges I see. So we need a proper structure to help people with their health, and also a sickle cell health policy. Okay, AS. That's a concept. I've seen people say, "Oh no, let them marry." The truth of the matter, as much as is your choice to marry, I always say you have options. It's not by force you should have children if you have to marry, because we always look at the love part. We don't look at the child part and the challenge that I've seen parents. I had a argument on Twitter when I said that the father is the first person to leave the relationship when they feel the thing is getting too much. And there are two types of living for the father. There's the physical living and the emotional living. Having a father present, but yet the father not taking or recognizing that child is their child. Or I'll still pay your bills, I'll still support you. Those are the challenges we face. So I say, please, for the sake of the child, don't marry. But if you must, know your options, learn your options. There's adoption. It's not by force, but for people who are in the low income, don't even try it, because in most cases adoption will not work for you, and the other one is too. So don't even think about it. Once you know that both your genotype separates, and the truth of the matter is that yes, people's experiences with sickle cell are different, but they are not God to determine what that experience of that child will be. And when you are poor, you cannot manage that child, and once that child cannot be managed, there's a probability that the complications will increase in that child.